Assalamu alaikum and welcome to California Care. Today I'm going to talk about oral surgery and extradontia to be exact. The most used instrument is actually, of course, this is a periosteal elevator with a pointed tip and a blunt rounded tip. This is used to go in and sever the PDL all around the tooth. It is actually the PDL that holds the tooth inside the socket, not really the bone. So if you sever the PDL very nicely all the way to the bone, then it's very easy to luxate or move the tooth into the bony socket and just the tooth pops right out. So this is the instrument which is used the most. Then these two instruments are used the most after that. This is the extradontia elevator. It is angled plus serrated, and I got a negative of that made too. So if you take a look, in this case the serration is on the inside, and in this case if you look at it, the serration is towards the outside. So they are actually exactly opposite of each other. This one is serration on the inside and this one is serration towards the outside. This is used for extraction or elevation of the tooth, and in case I have a hard time to reach in the mesial root, I can lift that up. So this will be used to extract the whole tooth, and in case the mesial root is sectioned off, I can pull that up with this. There's a separate video on how to use these elevators on my channel. Please make sure you watch those. Now we do all the extractions with basically this and this instrument. Occasionally I need this. Now forceps are used very rarely, extremely rarely. In case the root is all loose and I need to pick it out, I would use these forceps with very pointed but serrated tips just to go inside and grab a hold of the broken root and then pull it out. So these are used in case, very rarely, otherwise an elevator will lift it up. Now on this side we have molar forceps, but this is a universal pair of forceps. In case this is class 3 periodontally involved tooth, after the severing of the PDL with the periosteal elevator, I would use this just to pluck the tooth out, used extremely rarely. All of these forceps are about 30 years old, and you can tell they're in brand new condition because we hardly ever use them. In case there's a root that I need to break out, these are pair of rounders, and they have sharp inside with serration, so you can grab onto the root and pull it out. This would also be helpful in case you have a broken instrument inside it and you can pull it out with that. You can cut the bone with it. I would not use it for alveoloplasty because alveolar bone needs to be left there so it can heal a very nice and thick for you to have a thick ridge that you can place an implant later. But in case you need to recontour any bone anywhere, or you can utilize this to harvest bone for bone grafting and chipping. Now, when it comes to these forceps, these are for the molars, lower molar and upper molar. I've seen a lot of people refer to this forceps as cow horn, but the cow horn really looks like horns. If you look at them, these are two horns, and they go in between the buccal and the lingual of the lower molar to luxate and then to pull out the tooth. These are another pair of forceps for the molars. This goes into the buccal root interradicularly, lingual root interradicularly, and again the angle is 90 degrees, so you can do figure 8 extraction. But like I said, don't use it, only use the elevators to take teeth out. This one is for the upper third molars, and you can get behind the tuberosity and hold on to the tooth and take it out. But again, I use the elevators to take out the upper third wisdom teeth also. Please do watch my other video on extractions, and I hope it helps. This is all you need ever to have a good extradontia practice. This is what you really need, but 3 and 3, 6 more pair of forceps. That is all you need, and I've needed these no more than for the last 35 years. If I were to have only these forceps, one each, I have about 3 pairs of these, one each, one each, one each. 4 or 5 of these elevators. So you can set up a dental practice if you're starting new. Just have one each of these forceps and 2 or 3 pairs of these and 3 or 4 of these periosteal elevator, and you're set for life.